Welcome to our presentation created by our team of public health professionals. On our team, we have Gabriela Mauricio, Rudy Gupta, Luis Quintana Lopez, and Sierra Small Harris. In this video presentation, we will be highlighting the Center for African American Health Organization. This organization is being highlighted by us due to its mission to improve African American health during a time where health disparities are vast. As the organization says, live well. The disparity our team has focused on is the lack of access to healthcare that the African American community has. The lack of access to quality healthcare has been linked to a problem known as structural racism. The issue was brought to light especially during the COVID-19 pandemic. This occurred because of the drastic difference in death rates from the virus between minorities and Caucasian Americans. These inequalities are results of ethnic and racial minority populations' unequal access to quality healthcare, which continues because of structural racism in the healthcare system. The idea of structural racism is controlled by large-scale groups, not necessarily a single healthcare worker believes. Overall, this inequality is one that has been affecting our communities far too long, so it is up to small organizations and other groups to stand up and begin fighting against the structural racism that affects Americans' health. The health significance of health disparity is that African Americans continue to struggle with poor health in comparison to other racial groups due to this lack of access to quality care. Compared with white patients, racial and ethnic minority patients are less likely to receive evidence-based cardiovascular care, kidney transplants when indicated, age-appropriate diagnostic screening for breast and colon cancer, timely treatment related to cancer and stroke, appropriate mental health treatment, and adequate treatment when presenting suffering from pain. Another area that shows this disparity is in the gaps of uninsured people. In the past, there was a large gap in those falling below the poverty line and those not covered by Medicare and Medicaid. Luckily, after the Medicare and Medicaid expansion, the gap has been decreased, but it is still present nonetheless, with many minorities being a part of the gap. The Center for African American Health Organization's goal is to improve the health and well-being of African Americans in Metro Denver by offering community-based, evidence-based disease prevention and disease management programs, events, and services. They push this idea through their saying, empowering the community to live well. This saying truly emphasizes the idea that smaller organizations are taking the power into their own hands and doing the work to positively affecting the health and well-being of the community. African Americans' lack of access to care is a health disparity that needs to be addressed in the U.S. on a massive scale. Due to African Americans' lack of not having proper medical care and treatment in health facilities, it has caused severe detriment to this country, like higher risk of heart disease. Social media platforms such as Instagram, Facebook, and Twitter would be the best way to tackle getting the word out and getting further help. It is important to outline and outcast this problem because without others knowing, they cannot help. If anyone starts by posting the statistics and the problem on Instagram, for example, it can reach other people in power who can help, such as healthcare worker professionals and people in leadership. It could be achieved by posting about it, reposting on stories, and direct messaging those who can help. This situation needs to be addressed as soon as possible because it is unfair and affecting the community that we live in.